to loosen their shoulders, relax.
While we're talking about the relaxing and the moving of the toes and the gentle massaging of the muscles, does that help everybody? Would some people prefer not to have their jaws massaged from a neuroplastic and...
Yeah, no, so that you discover in the moment. So some people, you can use your 3 fingers and just go flat here, and just tell the person, you come and do that from the front. You look into their eyes, say, close your eyes and just breathe in and relax. Open your jaw, close your jaw, open your jaw. And if you feel tension here, it could be just nervous tension, and then you go, okay, fine. What does it feel like? Or get the person to take both their hands and go, I'd like you to take your hand and do a figure of 8 on your forehead, and then come to your temples and do a figure of 8 over here. So they can then massage themselves. The moment you feel they're uncomfortable with someone else doing it, then they do it. They can put their hands on their own shoulders, cross themselves, feel comfortable. I want you to hug yourself and know I'm in a safe space. So I'd like you to breathe in and just breathe out and just hug yourself, that you feel I'm in good hands, I'm comforted, this is a good day.
Absolutely.
I don't say...
And it is critical. It is critical to have your dental issues and any other health issues attended to as soon as possible.
Yeah.
Because early diagnosis means treatment can be initiated correctly, which means the consequences and the complications which will arise with time are less. So
you can coach a person by hugging themselves and go, I want you to close your eyes and say to yourself, this is a good day. I'm loving myself because I'm paying attention to my dental health.
Yes. Or my medical health, wherever they may find themselves. And attending to our health issues can only lead to better performance, whether it be at home, at the office, on the athletic track, on the bicycle, wherever you find yourself, because you're just healthy. And so you can function optimally.
Yeah. So that's why affirmations don't work, because affirmations need to feel the energy in the body. So if you say every day and everywhere I'm getting better, the energy in the body goes, I don't believe that energy.
I don't believe that.
It's like ba 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 ba. But so I embrace the fear of I'm in the dentist chair, I'm in the doctor, I'm on the operating table. I embrace that fear. I breathe in and I say to the fear, thank you for giving me the message, because I'm now using you to say this. I need to be here because I love myself. So fear, thank you for the warning, but just go backstage now.
Yes.
And now I'm practicing self-love. I'm practicing, it's critical for me to have my dental health paid attention to, because all sorts of stuff can happen. I can get poison and toxin, bacteria, that goes into every blood cell, that goes to every organ in the body. So whatever happens in the mouth goes to every organ in the body. So I want to be able to make sure that my oral health is focused on well-being, rather than my oral health being, I've brushed my teeth and that's good enough. It's not.
Which it isn't.
It isn't.
Something that really makes a big difference for our patients that have extreme phobias in terms of dental anxiety and dental fear is intravenous sedation. So with intravenous sedation, we get an anesthetist who comes into the setting, and they then put up an IV line, and they then medicate the patient according to the patient's specific requirements, according to our requirements for the procedure. And that enables the patient to be completely relaxed, which means then that we can work in safety and confidence, knowing that the patient is completely safe, completely comfortable, and we are able to treat whatever needs to be done. So we make use of intravenous sedation where the patients do not or have not had access to coaching. That is a very important
factor.
We can just get over that for a moment, that extreme phobia.
Yeah. And even in that moment, you can say, the specialist, call them specialist, is going to put an intravenous and it's going to help you to relax. So I'd like you to go to a place where you relax.
Yes, a happy
in your
place.
Garden.
Yeah.
Where is it? Where do you relax?
Yes.
On a mountaintop, at a seaside, where is it where you relax?
Yes.
And then I want you just to invite that relaxing feeling and breathe it in. So then you breathe in, and then I want you to say, feel it in your shoulders and breathe it out. Then you take a deeper breathe in, feel it around your heart and your chest and breathe out. Breathe in, take a deeper, feel it around your belly and into your hips. Breathe in, feel it going down all your legs right down to your toes. Crunch your toes and feel it there and breathe out and relax your toes. So you are orchestrating through cognitive coaching for neurology to awaken in a state of relaxation. So it's almost that you're getting the neurology to get the person into a trance-like state, which is one of the brain waves. So you need to get them to go there and let them go with the flow. You got the procedure, it's going to help them, but make them consciously aware.
Yes. We know without a doubt that bacterial plaque that is left in our mouths with time changes from bacterial plaque that is not that pathogenic or dangerous. The bacterial population shifts and changes to a bacterial population that is very dangerous to your teeth and to the supporting structures, the gum, the periodontal ligament, and the bone around the teeth.
And that eventually goes into the bloodstream,
Yes.
right?
Now, what is so interesting is that according to current research, that a patient who has minor ulceration, these are microscopic ulcerations of the gum, underneath the gum, around the tooth, that ulceration in periodontal disease, advanced periodontal disease.
That's like when the gum is red, right?
When the gum is red, when it's swollen, if you notice spaces that are happening between your teeth where there were no spaces, if you notice that teeth are becoming a little bit loose, if there's bleeding when you brush or floss, those are all signs that periodontal disease could be starting or in fact getting worse. If you put all of those ulcerations together, they say that those micro ulcerations would be the size of your hand. That means that the bacteria and the inflammatory products enter directly through that ulcerated area into the blood vessels, which are around the teeth in the mouth. And those blood vessels are obviously connected with the blood vessels of the entire body. What happens when those bacteria and inflammatory markers get to the brain?
Well, it first of all goes into the blood. So It gets through the blood. The moment it's in the blood, it immediately affects, so you get inflammation, factors that happen within the blood, and inflammation is the invitation to cholesterol. And then you get red blood cells that instead of are little circles that are floating around, they join together and they become like this, looks like a snake in the blood. And so they just congeal together. So that's the effect of inflammation. You'll pick it up with there. And then the bacteria are little black spots in the blood that actually dance around. You actually see a little bacteria dancing around in the blood. And then that blood and bacteria goes up into the heart. From the heart it goes to every other organ in the body. So it lands up in the brain. And that inflammation...
So this is critical, is that bacteria from the mouth, as well as the inflammatory markers and the inflammatory products and the inflammatory cells, get into the bloodstream. They go to the heart and then they are disseminated not only to every organ, but basically to every cell, including our skin.
Absolutely.
Yes.
Yeah. So the skin tags and all of that, it's a blood problem. There's something that's in the blood. And the biggest issue that we have to tell people in their general health is to get your pH in your body right.
Yes.
So they need to go and get a litmus test. And the moment they've got the litmus test, they need to get to a homeopath so that they can sort that lot out. So
this is a critical factor in the mouth. We have two phases. The one is remineralization, where the teeth have the capacity to be healed because they are remineralizing.
Okay.
And then we have demineralizing, which is where the minerals are actually leached or pulled out of the covering of the tooth, the hard part, the enamel. Once that demineralization gets into the dentine, the tooth cannot heal itself. You then need to see your dentist to get it basically drilled and filled.
Yeah.
Critical. So,
and build.
I was waiting for that. I was waiting for that.
Yeah, my name is Bill Price, so you get the invoice with me.
Now,
okay.
What is so interesting is that the saliva not only washes the bacteria away that are in our mouths, but it buffers the acids that are produced by the bacteria that are feeding on the sugars. So we have sugars, we have carbohydrates in the mouth. The bacteria utilize those sugars. They produce acids. The acids take the remineralization to the demineralization. It starts with a microscopic defect on the tooth, on the weakest part of the tooth. It always does. It looks for the weakest part. And then it progresses with time. So we need to make sure that our mouths are always adequately moist in terms of having sufficient saliva. We need to keep the bacterial populations under control.
And then we do keep it alkaline.
And that we keep it alkaline and not acidic.
Yeah.
And this is a problem where people who really like, for example, lemons the whole time in their water, because what's happening is you're adding more acids. Our athletes are at great risk because the sports drinks are generally a lower pH, acidic. They are full of sugars. The bars, the gels, the goos are all highly sticky and adhere to the tooth surface and are obviously full of the carbohydrates, the sugars that we need for refueling. So we have bacteria that can't be washed away. We have breakdown products that cannot be neutralized. And we're just feeding them sugar the whole day. Yeah. It's like nuclear war. And that's why it's important to brush properly with a soft brush correctly. So you need to make sure that you know the correct brushing technique by seeing your dentist and your oral hygienist regularly. Oh, and by the way, contrary to popular belief, there's no set program for how often you need to have your teeth cleaned. It really is how often do you need to have your tires changed on your car. Everyone needs a customized program.
Yeah, wow, that's interesting.
Yeah, because some people maintain their oral hygiene and their health generally so well, and with time their dentist could say to them, okay, I could see you every 6 months. But we have other patients where we need to help them on a monthly basis.
Yeah. So taking to close off, to take the inflammation and the bacteria that goes into the blood, into the brain, eventually over a period of time, you get enough of it in there, then that inflammation can trigger off an epicenter of Alzheimer's disease, dementia, strokes, the beginning of an invitation party to a stroke, and all sorts of other scary stuff that goes, memory loss and all of that. So, yeah, it's not good when the dance between inflammation, biology and neurology, when they all dance together, they all come to the party and they're all impacted.
Yes. And this correlation between dental health and systemic health has been well researched.
Absolutely.
Especially by the periodontal organizations. And I know that it was Professor Andy Huberman who was talking about recent research, and I'm not sure if it was done from Stanford, but he spoke about it on one of his podcasts, where they've actually are now proposing that the bacteria from the mouth crosses the blood-brain barrier and is now thought to be involved in the precipitation of Alzheimer's disease as well.
Yeah, no, absolutely. Yeah. So the research, and thank goodness for it, that's we're moving from what I don't know to what I should know, which is a lovely, lovely gap. But it's been wonderful chatting to you. I feel so relaxed. You can go ahead and take all my teeth out now.
No, that is not how we will operate today. But I must say that not only did I enjoy spending the time with you, but the time has flown. We haven't got to do any dentistry. But I must say that I feel enlightened and I feel quite relaxed.
Yeah.
Just by watching you do the breathing exercises. So
and
really,
at some stage, we'd love to be able to make available an opportunity, maybe a workshop for dental workers and dental health practitioners, to talk a little bit about the neurology and the conscious mind around the whole visit from both sides.
So how would they be able to contact you then in terms of
they can contact my email is bill.price@me.com. Okay. So it's my name with me in it and and a .com in it.
That's a very, very interesting email, because it's really about talking about that I'm really comfortable with myself. Won't you just unpack that one again for me?
It was it's bill.price, full stop, Price, my surname, at me.com. Okay. So Bill Price is the name. It comes together in me. That's my identity.
Yes.
And .com is where you find me on the space post box.
Fantastic. Well, thank you so much.
Thank you.
I really, really appreciate it.
It's lovely talking to someone who is so passionate about oral health, and I'm so thrilled that I'm part of the process, small part of the process, to get the message out there.
Thank you so much. Paul. Thank you for your time. We really want to thank you for taking this time to spend with us, because it has been a fascinating time and an enlightening time in terms of understanding that wherever we go, that this comes with us, that it is an intricate part of everybody, and that we can never isolate one part of the body from the rest of the body. So thank you for spending your valuable time with us.